So our next speaker is Megan Trewhella, and I'm sure many of you know Megan. She is one of the nurses here. So she's actually a melanoma nurse consultant at the Peter MacCallum Centre, and she's worked in this role for the last 4.5 years. And overall, she's had 10 years worth of cancer nursing experience. She's completed her Masters in Advanced Nursing Practice and is an active member of the Cancer Nurses Society of Australia. Megan has a particular interest in patient education and has been involved in the development of patient resources for both immunotherapy and targeted therapies. So please welcome Megan. Oh, it's gone. Yes.
So thanks, Alison, and thanks for the opportunity to come and speak to you all tonight. So I thought I'd just spend the last session just about 10 or 15 minutes talking about the role of the melanoma nurse consultant at Peter Mac and the supports that we can offer patients and how we function here at Peter Mac. And then also just at the end highlight a few resources that you may or may not know about that you just might find helpful as you go through your cancer diagnosis. So I guess a good place to start is defining what is a nurse consultant, and I guess we would say that we're an expert nurse in the field of melanoma, and that's, I guess, basically, that's just the area that we work in is melanoma and skin cancers, and we work across the different teams, so with medical oncology, surgical oncology, the radiation teams, and also the dermatology teams, and we act as sort of the link between the patient and the doctor. And so I often, when I'm meeting patients for the first time, describe our role as being that first sort of point of contact. But particularly when you're not in the hospital and you've got questions or concerns or things that pop up, we're often the person that can be, at the end of the phone. So here at Peter Mac, we've got 2 melanoma nurses who I work full-time, about to go off on maternity, not too far away, and another nurse that works part-time. And at Peter Mac, being a specialist cancer centre, we have nurse consultants that work across all the different cancer types. So being that first point of contact, we, I guess examples of what we might get, questions about, so it might be patients that have been sort of on surveillance post-surgery and, you've got a new lump or a new spot that pops up and you're concerned about it, then, we're that person you call to get that first sort of point of advice and about, what you may or may not do. Sometimes we get inquiries about patients who have had, their surgery and they might be having some complications post-operatively, and we would again be that first sort of point of contact for providing that advice. And a lot of our work now is supporting patients that are on, the drug therapy. So as Grant did sort of mention, we have access to a lot more drug treatments, particularly in the last few years. And so I guess a major part of our role now is actually, providing that education and support, and particularly managing a lot of the side effects that may pop up for people that are on either immunotherapies and targeted therapies. So we provide the support either face-to-face, so you often see us around in the clinics. So we have clinics melanoma clinics at Peter Mac that are running pretty much every day of the week. We visit, the day therapy, so where people might be getting their infusions, or go to the wards and see patients as well. Another major part of our role is just providing that phone support. So I guess probably half our time is on the phone with people and answering those, being that first sort of line to answer any questions or queries or concerns, and then also again a lot through via email as well. As part of our role, we look at all the new referrals that come into the service. So we triage them with our team of doctors as well, and so we allocate sort of the new appointments, and particularly if patients need any scans or tests or extra things organised, we're sort of that person that's contacting to get those types of things organised. We work very closely with our admin team, so at Peter Mac they're called patient navigators, and we just try and work with them in the scheduling of appointments and scans. I know sometimes it doesn't always go to plan, but we know that's an important part of patient care is getting all those scheduling things right, and so we try our best to work with our admin team to do that. As I did mention briefly before, the role has sort of, evolved. As Alison mentioned, I've been doing the job for about 4.5 years, and it's certainly changed, particularly in the last 2 or 3 years, to be a lot more focused on supporting patients that are on the drug treatments, and providing that education, particularly for patients that are on immunotherapy or targeted therapies, and doing a lot of the side effect management. So often we do a lot of that over the phone, either providing that advice ourselves or having a chat with our medical colleagues about what the right plan of action would be. We find it really important to know patients know who to contact and when to contact, and how to contact them if there are any queries or questions that are popping up. Another major part of our role is looking at how we can best support the patients as they're going through treatment, and so we try and do a good assessment of what other supports may actually be helpful as you're going through your cancer diagnosis. And so we may talk to you about referrals to other services, so that may include other referrals to services such as psychology, say for anxiety, or there's significant stress around a diagnosis. And we have a great team of social workers and parent support workers at Peter Mac, particularly if patients have young children. Our parent support worker can be really helpful in helping patients talk to their young children about their cancer diagnosis, and other resources such as the dietitian and the physiotherapy. So we'll try and have a chat to you about what things we can put in place to to try and help support you as you're undergoing treatment. We also understand that the carers play a big role in supporting patients. So there's often a lot of stress on the carers because they're often going through the diagnosis with the patient, plus taking on board a lot of the other responsibilities and things that life that keeps happening. And so there can be quite a bit of carer stress around a diagnosis of melanoma as well. So we do our best to try and support the carers and family members as well. I guess the thing to note is that each different hospital you set up might be a little bit differently, so it's just good to know if you can have access to a type of nurse in this role and how you would access them. Other hospitals are set up with sort of cancer care coordinators, so it might be a nurse that's responsible for a couple of different cancer types. Or, if you're private, it may be that you have, direct access to your doctor. But I guess it is just important to know, how you contact and who you contact, to get the extra supports that you need. One of the common pieces of feedback that we get from patients is that they just find our role, quite reassuring, and they just find that having easy sort of access to a person who's working closely with their medical team just quite reassuring, and particularly to be that first line of that can answer a lot of questions and concerns and worries that otherwise you might be waiting weeks for your next appointment to maybe be able to have a chat to your doctor about. So I think that's one of the main positive feedback that we do receive about our role. So I just wanted to touch on a few extra resources that you may or may not be aware about, which you might find helpful. There's a suite of videos about immunotherapy that actually my colleague Donna Milne was developed. She did some research that found that this type of education on treatment was something that patients were missing. So often when you're coming into hospital and learning about new treatments, you often hear what the doctor will tell you, what the nurse will tell you, and then getting some written information. And they found that people actually wanted to hear about other patients' experiences having on treatment. And so these videos were developed sort of for patients and by patients. So they do feature some health professionals in there, but it's mainly patients and their families talking about, their experiences on immunotherapy and going through, the preparation, the side effects that you might expect, and some of the lifestyle changes. So we've had some really good positive feedback about the videos, and I think they're also helpful for people to pass on to maybe their family and friends, for them to have a bit of a watch, particularly if they haven't been to appointments, and so they can get an understanding of, what they're actually coming into the hospital for. Another good resource, which has just sort of recently become available. I think it was in a pilot stage, but now it's being rolled out to a few different areas, is this XMed cancer program. So basically, it's a service you can get referred to, and you get access to an exercise physiologist. And so they can provide you with an exercise program. There's a lot of information around about, the importance of exercise, with the cancer diagnosis, and it potentially helping to manage some side effects, and particularly, one of the main side effects that we see patients get is fatigue. And so this may certainly help that. So the exercise physiologists are at local gyms. I think you get a good session with them, and a lot of the exercise classes you do with a group of other cancer patients as well. And it's about a 4-month program that you get access to doing this. I think it's about $30 a week or so, as I've heard, is what the charge is, and people that have gone to the service have actually given really positive feedback. So you can either get your healthcare team to refer you, or you can just go onto the website, and you can also just refer yourself, and someone from the team will get in touch with you. As Jane did mention, there's the Wellbeing Centre at Peter Mac. So any Peter Mac people that are here that don't know about it, it is on level 1. And there are quite a lot of good programs that run out of the Wellbeing Centre. So it's a good place just to pop down, in between treatments while you're waiting around the hospital. You can get, a cup of tea. They also run quite regular programs there. So like once a month they talk about, there's a session on exercise. Once a month there's one on lymphedema, and also on fatigue. So it's good. You can either check out what's happening on the website, or also, just pop down to the centre. Other activities they have there, they've got like the hand and foot massage. I think they've just employed like a qualified masseuse, so you can actually book in for massages. There's cooking, quite regular cooking demonstrations, and it's actually a melanoma patient that runs a lot of the classes. I think he does quite a few Spanish-inspired feasts, so that's always good to get down to. But yeah, certainly worth going to that space if you are in Peter Mac. I'm sure everyone knows about the Cancer Council. So they obviously involved in a lot of work around cancer prevention, but they also do provide a lot of support for cancer patients. So particularly there's a program, Living with Cancer, which is an education program that you can refer yourself to. There's lots of resources there. Another one is for carers and caring for somebody and supporting someone with a cancer diagnosis. There's resources about returning to work and how to manage, work life and cancer. There's also a really good holiday break program that people can nominate themselves for. So, particularly if you've got young children or you need time to get away, you can apply to be eligible for one of the free holidays. And they can also provide some legal and financial advice, if required as well. And that a lot of the legal and financial services they, provide are done pro bono as well. Weekend is a relatively new website, and it's basically a website set up with just like a hub for all the supportive care resources that can be out there. So I think there are actually quite a lot of resources out there for patients, but sometimes it's hard to find them or get access to them in the one spot. And so basically this website, it sort of acts as a bit of a directory to get access to those types of supports, and also provides some information about, common cancer types and concerns. So that's another website, probably recommend that people just have a look through. So they might find something there that they haven't previously known about. For looking for a little bit more education, the VCCC run quite regular education sessions that people can go to. So they run like a Monday lunch live, so you can often go on their website and register for those if it's something that you're interested in going to. There's this TEDx Living with Cancer coming up, which I think Grant is chairing, and so that's an event I'm exploring about how people deal with a new cancer diagnosis and how they can be supported through that. So you can also just go onto the VCCC website and sign up to the mailing list and just get regular alerts about, some education that might be popping up. That's me.